Is this the silo? I know.
According to stakeholders, social protection is not only about reducing poverty, but also about protecting communities from shocks such as illness, unemployment, climate change, and economic hardship.
I'm also happy to inform you that in the next financial year, we are starting a program on child disability grants, which will be 100% government funded at 15 billion. So we are taking steps in that direction. Then also enhance public awareness to inform the communities and inform the public about these programs so that they can participate in the planning and the implementation.
Flavia Kabahenda, chairperson of the Uganda Parliamentary Forum on Social Protection, says the forum continues to work with civil society organizations to influence Parliament to enact better policies and laws that promote social protection.
To indicate that social protection must be provided for all the people of Uganda. And we are taking social protection as a humanitarian tool, and so it must continue to be given up to the whole life cycle.
Stakeholders emphasize the need to expand social protection programs to people working in the informal sector, noting that many Ugandans earn their livelihoods outside the formal employment system and therefore remain exposed to economic risks. They called for universal health insurance coverage and expanded social protection programs for children and persons with disabilities across Uganda.
We should ensure decent labor, decent employment. After people have come from school, they must enjoy decent employment. So you can clearly see that at every stage of the life cycle, there is a social protection benefit that we need to provide.
Stakeholders further urged government to prioritize the National Health Insurance Scheme, describing it as a key component of a comprehensive social protection system. They also called for a dedicated budget for social protection programs to ensure sustainable support for older persons, children, persons with disabilities, refugees, and other at-risk communities.
But most of these programs have a very low coverage. We did talk about, for example, the 3 groups in disabled for the whole district is really very low. Even with the child disability program that we're going to implement, the coverage is very low. At least percentage is near 100%, very good. But largely, if only 6.4% of our vulnerable population are covered by this one social protection program, when the sub-Saharan average is 17, then we have work to do. But also these programs are very fragmented and don't cover the persons in the informal sector. So we also need to pay attention to the informal sector, including refugees. This is something that we are continuing to build, the capacities of all of us to appreciate social protection. We're running a curriculum called Transform, which is a social protection training curriculum, which we run for various stakeholders, and this helps us to appreciate and understand social protection.
The forum says social protection should go beyond support for the elderly and include maternal health, child nutrition, early childhood development, health insurance, decent employment, and workplace protection to ensure all citizens live dignified lives.
The risks and